Now for the hormonal methods. The first method is the birth control pill, or oral contraceptive pill. The pill is made of a combination of synthetic hormones, almost like those produced by the ovaries. One pill is taken at the same time each day, whether or not you have sex. The pill is 99% reliable if used carefully, but if not used carefully, it's 97% effective. There are two types of pills, the 21-day and the 28-day. For the 21-day, you would take 3 weeks of hormone pills, and no pills are taken during the 4th week. For the 28-day pack, 3 weeks of hormone pills are taken, and 1 week of cornstarch or reminder pills are taken. Next is the Ortho Evra patch. The Ortho Evra patch is a contraceptive patch that contains the same hormones that the birth control pill has. The patch is applied once a week for 3 weeks, followed by a patch-free week. The patch prevents ovulation. It changes the cervical mucus, changes the lining of the uterus, and changes the lining of the fallopian tubes. If used correctly, the patch is 99% effective in preventing pregnancy. Next is the NuvaRing. The NuvaRing is a flexible vaginal ring that contains estrogen and progesterone. The ring is inserted into the vagina for 3 weeks, then removed for 1 week. It is 98 to 99% effective in preventing pregnancy.
Depo-Provera is an injection that contains progesterone only. It is given every 11 to 12 weeks. It is more than 99% effective. The injection is given in the arm or buttocks. The emergency contraceptive pill or the morning after pill are pills containing synthetic female hormones. This is for use when unprotected intercourse has occurred. It should be used within 72 to 96 hours of unprotected intercourse. It prevents pregnancy by altering activity in the fallopian tubes, so the sperm cannot reach the egg. It reduces the risk of pregnancy by approximately 75%. 2 doses of the pill are taken by mouth 12 hours apart.
All right, so that covers all the birth control methods that we have available here at the Health Center. Do you have any questions?
If I'm taking the birth control pills, is it still possible to get an STI?
Good question. Birth control pills and other hormonal methods do not protect against sexually transmitted infections. The only methods that protect against sexually transmitted infections are barrier methods or abstinence. Now I will discuss vaginal spermicides. With all these methods, if alcohol is involved, decrease effectiveness with inability to use correctly or forgetting. Reminder, non-oxidol 9 does not protect against STIs and causes vaginal irritation. Vaginal spermicide is a medication that contains non-oxidol 9. The different forms include gel, foam, cream, film, suppository, or tablet. They may be used alone, with a vaginal barrier method, or in addition to hormonal methods. Spermicidal products kill the sperm. The film is used by folding down the center and placing it into the vagina at least 5 minutes before sex. The film immediately begins to disintegrate in the vagina. The film is not available at the health center. The next section is vaginal infections and sexually transmitted infections. Sexually transmitted infections can be transmitted through unprotected and even sometimes protected sex. This includes oral, anal, or vaginal sex. There are two types of sexually transmitted infections. These include bacterial infections and viral infections. Bacterial infections are infections that can be cured with antibiotics. These include chlamydia, gonorrhea, and syphilis. Viral infections are infections that cannot be cured. They can only be treated. These infections include genital warts, hepatitis B, HIV, and herpes. It is important to know that the use of alcohol or drugs during sex can severely impair a person's ability to use birth control effectively. Remember, the only no-risk choice is abstinence. If a person is worried that he or she may have a sexually transmitted infection, encourage them to speak with a clinician. Symptoms of an STI include lumps, bumps, rashes, swollen lymph nodes in the groin area, pain during urination, pain during intercourse, unusual or foul odor smell in the vagina, or in males, discharge from the penis. Remember, a person can have a sexually transmitted infections and have no symptoms at all. This concludes the session on women's health and the women's health exam. If you have any further questions, the clinician will be more than happy to answer them during your scheduled appointment. Thank you for taking the time to view this video. We hope the knowledge presented to you has given you a better understanding of women's health issues as well as the exam procedure. You can reach Weigel Health Center at 878-6711. In case of an emergency, call the University Police at 878-6333.